What if I miss a scan due to lockdown? It depends on what scan you are talking about. See, now, if I would also want to know what weeks of pregnancy you are at. Okay, 18 weeks. Yeah. So I think it's okay if you don't have to miss your scan. You can actually book an appointment, say after 2 weeks. I think another 2 weeks the lockdown will be over, and after 20th we are also expecting the government to put certain relaxations. So you can always book an appointment with your clinician. But I think there are 2-3 points that you need to be just careful about when you're going to the hospital. Make sure that you do not go with too many bystanders. Make sure that you're only going with one visitor with you, and avoid taking elderly people or very small children as companions with you when you go to the hospital for your appointment. Also, make sure that you do not have any respiratory symptoms, no history of fever or dry cough in the past 1 week or so, and you have not come in contact with somebody who has a traveling history to all these COVID suspected areas. So I think in another week or so, the government is definitely going to come up with some relaxations, and your 18-week scan is something which you should not be missing, but definitely postponing it by around 1 week to 10 days is not going to create any harm. So that should be perfectly fine. Now, if the placenta is low-lying at 18 weeks, you don't have to worry. Most of the times what happens is the placenta, which is the major organ that supplies the blood and the nutrition to the baby, will be low-lying when you go for a 3rd month, 4th month, or even an 18th-week scan. So if you found that the placenta is low-lying, what I would suggest is you go for a repeat scan after 6 weeks. So around 24 to 26 weeks, and get a transvaginal ultrasound done. And if you still find that on a transvaginal scan, the placenta is low-lying, then your gynecologist will have to take the adequate precautions. But in 90 to 95% of the times, your placenta will gradually go up as the uterus grows up by 24 to 25 weeks. So you would not have to worry. How to increase tummy as the size is less? My dear, we all have been worrying about our larger tummy sizes, and today I have a question with you don't have to worry about your tummy size as long as your ultrasound tells you that the baby's growth is fine, because there are various factors. Some of them can be, if you're tall enough, your tummy size might not be big. If you're already on the heavier side, your tummy might not look very big. So as long as your scan tells you that your ultrasound, the baby growth is fine, you don't really have to worry about it. What about when the father has negative blood group and the mother has positive? That is completely fine. You don't have to worry about it. As I said, the only only situation where some complications can arise is when the mother is having a negative blood group and the father is a positive blood group. And that too, usually the complications do not happen in your first pregnancy. It is only in the subsequent pregnancies that there is a chance, if the baby is of a positive blood group, you can have complications of anemia and may require a treatment accordingly. Now, from normal ultrascan, is it possible to find lower syndrome abnormalities?
Down syndrome must be.
I think it was Down syndrome that you were probably implying. Well, Down syndrome we've covered. A lot of times we might be able to pick up abnormalities which can be highly suggestive of Down syndrome. For example, if you find there's a VSD, which is like a hole in the heart, or you find the baby's nasal bone is unossified, they all tell you that the baby is at increased risk. But again, you would not be able to say for sure that the baby is having Down syndrome on ultrasound. Even if we find something that is abnormal with the baby, we would always advise that you should undergo a confirmatory test. You take the fluid from around the baby and then find out whether the baby is having Down syndrome or not. Because when it comes to abnormalities like a hole in the heart, VSD, and if the baby is not having Down syndrome, it is an abnormality which can be completely corrected and the baby can have a normal lifespan. If the hole is very small, if the VSD is very small, the baby might not even require a surgery. But if it requires surgery, it has got very good outcomes. What is the difference between the ultrasound doctors do on daily visits and the sonography we do at certain months. Now, see, usually an ultrasound would not be required on every visit. If your gynecologist ends up doing one, is they are just looking at, the well-being of the baby. So when we say the well-being of the baby, they're just making sure that the heart is beating at the correct rate and rhythm, there is normal amount of fluid, the baby is moving nicely, and all those things. But when we go for certain specific timed ultrasounds, like when you go for a 12-week scan, then it is important that you have your Down syndrome screening done, you have your screening for major structural abnormalities. Similarly, the next important scan is when you have an 18 to 20 month scan, where you have an anomaly scan, or somebody calls it a targeted scan, TIFA scan, it's all the same. So where you look at the different structures of the baby and you try to rule out any kind of congenital abnormalities. And then the next important scan is at around 32 to 34 weeks, where you're going to look at how the baby is growing well inside, how is the blood supply that is coming to the baby, which we do with the help of Dopplers. So what happens is, there are different vessels which are supplying the blood to the baby. There's a vessel which gets the deoxygenated blood and takes the oxygenated blood and takes the deoxygenated blood back to the placenta. So we see with the help of Dopplers, along with your growth scan, if there is any variation, we also look at the Dopplers to find out whether there are any variations in the blood supply, because if there's any variation, that can also lead to a reduced growth in the baby. Does the genetic disorders come hereditary? Now, that's a very good question, because very commonly what we've seen is, especially with the disorders like Down syndrome, the most common perception that we have is, or when I see a patient who comes with an abnormal screening report, the common perception is of the first reaction is of denial. The patient immediately says, "Doctor, ये तो हो ही नहीं सकता. हमारे घर में तो किसी को है ही नहीं. There's nobody in the family who's having this. So we just cannot have this." Now, genetic disorders can come in both ways. They can happen as accidents, or they can happen because we are carrying it in our family. Now, what happens is, if you look at, I showed you this normal chromosomal makeup. So you see here that we have 2 on each position. Now, when you see 2 on each position, out of this 2, one is coming from the mother and one is coming from the father. Now, what happens is, and that's how an embryo is formed. So what happens is that during this fusion, if there is an accident, if 2 come together from the father on any of the chromosomes, that's what can lead to a situation like Down syndrome or trisomy 13, which can happen by accident even if there is no history of a genetic abnormality in your family. Again, there are other genetic disorders, like earlier I was mentioning about thalassemia. Now, when you get pregnant, you have different, inside these chromosomes, there are very small codes, I would say. These are called as genes. Now, what can happen is, I might be a carrier of an abnormal gene, and by accident or by chance I've happened to marry a guy who's also carrying that abnormal carrier gene. So I am having the abnormal carrier gene in a single dose, and he's also having that abnormal carrier gene in a single dose. So when we look at ourselves, we are completely normal. But what happens is, when we get pregnant, when the baby is formed, which is formed by the fusion of our genes or chromosomes, and we end up giving this abnormal gene, which is in a single dose in both of us, to the baby can have a genetic abnormality. And the chance of this happening would be 1 in 4. Or I would say 25%. So but this 25% is like tossing a coin. So you don't know whether you're carrying an abnormal gene or not. And it is not essential that a genetic abnormality would happen in your baby only if you have a history, and it always has to be hereditary. It can happen by chance. It can happen because you and your husband might be carrying an abnormal carrier gene. Of course, in the first pregnancy, we would not have a way to find it. Once you have an abnormal child like that, it is then usually when you get investigated and try to find out the cause and find out that, I was carrying this abnormal gene in a single dose and my husband was also having the same thing, and that's why we had a baby with this genetic abnormality. Hello ma'am, we are planning for the first child. Is there any test to be done before conceiving? Now, Deepak, I think you can just try normally for your pregnancy, and if you're not able to conceive for the next 6 months, probably you can consult a gynecologist and ask them if any further investigations are required. But otherwise, I don't see any reason you should be going for any particular test before conceiving. But yes, if you're planning a pregnancy, it would be a good thing to that your wife can start on folic acid at least for 3 months before pregnancy, because it is a good supplement that we can have before we start planning our pregnancies. Folic acid daily once should be enough. One of my friends asked whether excessive growth of hair over tummy during pregnancy is normal. Now, during pregnancy, you would have various hormonal fluctuations, and so if you have excessive growth, you really don't have to worry about it. I think that can be dealt after your pregnancy is over. Payal says, I am 11 weeks pregnant. My doctor asked me to do PAPA and beta HCG test in the 10th week. Do I need to get it done again after 12 weeks? No, Payal, that's another way of doing the Down syndrome screening. It's actually a more better way of doing it. So your doctor has very rightly done your biochemical markers, PAPA and beta HCG at 10th week. Now at the 12th week, you only have to go back to her for an ultrasound, where she would be looking at the NT, what I was talking about, the nuchal translucency of the baby, and they would be combining it together, and they would give you what is the risk that your baby is going to have Down syndrome or not.